Thank you for joining me today. In this video, you will learn traumatic and stress in children. Trauma and stressor-related disorders in a children. Trauma and stressor-related disorders is a psychiatric condition is triggered by exposed to trauma or stress event. Children symptoms include developmentally modified, so their developmentally is affected, often behavior or regression or somatic. Disorder requires exposed or to stress. So disorder require stress event must happen if the child having a behavior and they are regressing, if they are doing less than, performing less than their age, that means, and they are also having a somatic symptoms. It could be they have a traumatical event. Maladaptive emotion or behavior respond. Those are the symptoms also. Major disorder include a reactive attachment disorder or RAT. RAT core features include emotional withdrawal, inability behavior toward caregivers, inhibit. So they are angry, they are emotionally withdrawn, they are comfort seeking, they responded to comfort. Diagnostic clues include the history of severe neglect. So RAT mostly caused by the severe child neglect, and institutions, mostly foster children have this. Failure to develop healthy attachment can cause RATs. Other disorders include Disinhibited Social Engagement Disorder, and core features include Indiscriminate social ability. Child shows no fear of strangers. They will hug any stranger that come to them. Overly familiar behavior. They know everything. They are comfortable with everything. That is some of the core features. The key difference from RAT with DSED is overly social, no boundary. RAT is withdrawal, other is overly, so they are opposite to each other. RAT is a withdrawal from society and others, and the other one is with overactive. So this inhibited social engagement disorder is a over attachment, over socialization, over familiarity, they don't know stranger. Everybody is their family and everybody is love them, and that is what I think. Posttraumatic stress disorder in children. some of the features include exposed to trauma, abuse, violent accident, natural disaster. Symptoms include intrusive. So they have intrusive thoughts. They have nightmares, may not be recognizable. Nightmare, but they don't know what kind of nightmare. They cannot tell you. They will say, I had a nightmare, but they cannot tell you explicitly what they saw. Play enactment of a trauma. So they play or react. They have avoidance. They avoid people or places that trigger their emotion or cause them stress. Emotionally numb. They become emotionally numb. Negative. They also have a negative cognition or mood. They have a fear, guilt, detachment. They also have arousal, reactivity, hypervigilant. They are scared, hypervigilant. They are irritable. It's hard for them to sleep because they will have nightmare if they sleep, so they have a sleep disturbance. The other one is the acute stress disorder. Acute stress disorder is similar to PTSD, but duration is less. So it's 3 days to 1 month. PTSD may be progress. Attachment disorder. Attachment disorder is emotional and behavior symptoms within 3 months of a stressor event. It includes symptoms include anxiety, depression, behavior disturbance. Is less severe than PTSD and not specific trauma related. So nothing happened, but it is acute attachment disorder. So acute attachment disorder is emotional and behavior symptoms within the last 3 months of a stressor event. Symptoms include anxiety, depression, behavior disturbance. The causes of a biopsychosocial causes is biopsychosocial. So biological causes could be dysregulation of HPA axis. So dysregulation of the hypothyroid, hypothalamus, and change stress response system. Psychological causes include immature coping skills. They have immature coping skills. They had a trauma, and social and environmental causes include neglect, abuse, caregiver inconsistency, family dysfunction. If they lost their family, if they move around and change the houses, change the familiar environment, if they were scared, if there is something happen. All this can cause this. Assessment, the core component is you want to assess the traumatical history, type, when did that happen, what time that happened, how long it continued, how severe is the trauma. You want to assess the family dynamic. You want to assess the safety, that's the crucial. Are they safe now, or are they going through this trauma risk environment? Mandatory assessment, you want to assess if they are risky if they have any suicidal risk, if they are being abused, or if they are abusing somebody, or neglect. You want to report those. Differential diagnosis include ADHD, autism spectrum disorder, anxiety disorder, mood disorder. Those are the differential diagnoses that relate to the trauma. Treatment. First treatment, trauma focus is a psychotherapy. Trauma focus psychotherapy, CBT, is the gold standard. Components include psychoeducation for the child, for the family, for the caregiver. You want to teach them relaxation skills. You wanted cognitive restructuring. You wanted them to think a different way that they used to think. Gradually, trauma processing. You wanted them to process the trauma that happened. Okay. You want also child-focused therapy include play therapy. It allows the sympathetic trauma expression, usually useful in a children. Family-based therapy, parent-child relationship repair will be the therapy. Caregiver training, you want to train the caregivers. Relationship center care model, core psychotherapy principle. Environment and safety interventions include remove the child from unsafe environment, stabilization, the house, the caregivers, you want to make them stable for the child. Pharmacology treatment is only when needed and when it's severe. Medications do not treat trauma. They treat symptoms only. So, medication is indicated if there is anxiety, depression, sleep disturbance, agitation, those kind of symptoms you can treat with medication, but not the trauma. Common choices will be SSRIs are the first line of treatment for PTSD, anxiety, and depression. Clonidine and guanfacine are treatment for hyperarousal and impulsivity. For nightmares, if the child is having a nightmares, Brazosin is the nightmare treatment. For severe agitation, a typical antipsychotic medication could be the treatment. So the medication treat the symptoms, and they are symptom treatment management, not primary treatment. So they only treat the symptoms, not the trauma. And the psychoeducation, you want to normalize the trauma response. You want to teach the coping skills and emotional regulation. Complications of PTSD for children and adulthood disorders include substance use disorder, academic impairment. Those are the complications that it can cause. It can cause substance abuse disorder when they grow older, academic impairment, attachment disorder, increased suicidal ideation. So always assess the safety first. You want to assess abuse report, mandatory, if this is mandatory for you to report. Behavior symptoms often mask the trauma. If they have any behavior, that means they could be having a trauma. Trauma in a children play-based expression. Play-based expression. Attachment disorder include RAT, which is withdrawal, and DSE, which is indiscriminate attachment. Indiscriminate attachment does not help. So they attach to anybody and anyone. First line of treatment is therapy. Children reacting trauma in a play equal to, or it could be PTSD. No attachment to caregivers is the RAT. Symptoms within 1 month of the trauma is the acute disorder. Stress-related but not trauma-specific is the adjustment disorder. Conduct trauma-informed assessment and correlate multidisciplinary caregivers that include family education, psychotherapy integration, prescription of some medication that treat the symptoms, child safety, trauma-informed systems. You want to advocate for that? Thank you for joining me today. I would love to see you in my next video. Thank you.